Hi, my name is Catherine Corey, and I'm a second year Doctor of Physical Therapy student at Regis University. In order to make answering these questions easier for me, I asked a friend to ask them to me so I could respond back to them. So I apologize if I'm looking over the screen.
How would you handle this situation? Your patient arrives at the follow-up appointment and you bring them back to a treatment table in our gym. They start crying.
My first instinct is to get the patient a glass of water. In my experience in working with upset people, water is a great way to help the body calm down enough to have a conversation with them. After getting them water, allowing them a chance to gather themselves, asking them if there's anything that I can do, and after that conversation, seeing if there's anything in terms of the therapy session that needs to be changed from what we had originally planned in order to allow them to get what they need out of it, and also to make sure that we are helping someone in more than one way.
How would you handle this situation? Your patient comes in flustered because they could not find parking. Then they misunderstood how to check in on the computer and got into a spat with the front office manager, making them late for their appointment.
I think about this person as someone who's new to the clinic and new to how things run. And so I think it's a good opportunity to educate them on places that they can park if they are going to be running a little late, and double checking that they now understand how to check in to their appointments at the front desk so that doesn't happen again. I think it's hard to work with people when they're in a bad mood, but knowing that they can be in a bad mood, we can get our therapy sessions done, and it being a place for them to vent about how life has been and just being a listening ear, I think is more important in this situation.
Describe your greatest workplace strength, something you rely on daily when treating patients.
My greatest workplace strength is my verbal and nonverbal communication. I use both of those on a daily basis, whether or not I'm at work, in order to reassure patients that they are doing well on their form with like smiles and head nods, while if they're really focusing. Verbal communication is important in order to build the bonding or the trust between a patient and a therapist. So the small talk aspect of verbal communication to understand my patient, what makes them inspired, and how they want to live their life in the future with goals and exercise and activity, as well as the nonverbal aspect of reassuring them throughout sessions that, I'm here for them and they're doing well in their recovery or prehabilitation, whatever they may be there for.
Tell us about a time you built a therapeutic alliance with a patient that originally started out as a difficult relationship.
My first clinical experience was in Jackson, Wyoming, where they have a lot of summer residents, so people who live elsewhere the rest of the year. And there was a patient who we were talking, I was trying to find some areas of connection and things I could relate to, and I figured out that he lived in Denver, and I was like, I live in Denver, I can relate to you on this. So we started talking about that, and the conversation took a turn towards something that I wasn't really comfortable with. It was about things I wasn't well versed in knowing about, and so that was an opportunity for me to learn how to have harder conversations while also knowing when to shut them down and how to shut them down in a polite manner. And so I quickly just said, like, I don't know a lot about how, Denver politics works. I moved there last year. Like, I know a lot more about mountains and sports than anything, and so it was an opportunity to redirect the conversation towards Denver, but things that I knew about in areas that he may also know and care about as well. And so after that, it was a smooth sailing session, and it didn't leave any animosity between me or the patient.
How would you approach your CI if they're providing a type of treatment that you know has conflicting evidence on its effectiveness?
I think it's important to come to any conversation like that with curiosity and an open mindset to understand why my CI might be doing that intervention, and what he's like. Maybe he's seen a lot of good outcomes in the past using this, and so it's effective in his experience or their experience. But I think coming at that conversation with curiosity, and then also having interventions that I know are effective, or at least have less conflicting evidences of effectiveness, to have that conversation about things that I might think are better for this patient, but starting off with the wanting to know more aspect and leading that conversation into, here are some other things that I believe will benefit this patient. Do we think we can incorporate that into your treatment plan?
What brings you joy at work or in the clinic?
Joy, I've had many jobs where I've enjoyed going to work, and the common denominator is just a sense of community and belongingness and enjoying the people that I'm working with. Being able to have friends or some semblance of friendship in every coworker. I know it's not feasible to be best friends with everyone you work with and everyone you know, but I think civility is really important. Be able to have conversations with everyone is very important. And the jobs that I've loved the most, I'm able to come in and be greeted with smiles, greet everyone with smiles, and even if I'm having a bad day, know I can rely on these people to help me through it and help me through situations, good and bad. I'm gonna cut this part.
Yeah, that's